Hey everybody, John Turk here with Fearless Fitness, and I'm here today to talk to you about the pelvic floor muscles. More specifically, we're going to discuss hypertonic pelvic floor muscles. Now, a lot of you sometimes wonder, what are the pelvic muscles used for and how do they function? Basically, the pelvic floor acts like a hammock to support all the surrounding structures of the pelvis. More specifically, the intestines, the bladder, and the uterus in women. Now, what's important is if you have a weak pelvic floor muscles, it can affect the lower back, and it can also cause abdominal pain or pelvic pain. So one of the things you want to do is also make sure you don't have a weak pelvic floor. So I'm going to touch a little bit on that. Some of the problems you might run into with a weak pelvic floor is incontinence, inability to hold your urine, especially like if you find yourself coughing and you find yourself releasing. That's a sign that you might have a weak pelvic floor. The other one is low back pain. That's really common with a weak pelvic floor. So you want to do things like Kegels. Kegels is an exercise created by a doctor to help women gain their tone back after pregnancy. I'm not really going to talk much about Kegels. You can find out about them on a website, any searches on the internet, but they're very good for a weak pelvic floor. Now what we're going to talk about are hypertonic muscles or overreactive muscles in the pelvic floor. And it's really important to remember that if you suffer from hypertonic pelvic floor muscles, Kegels are definitely going to be something you're going to want to stay away from because they're going to aggravate the problem. Now, hypertonic pelvic floor muscles are caused from trigger points in those muscles. And a lot of times it's the secondary effect when you suffer from things like endometriosis or IC or interstitial cystitis of the bladder or pelvic floor dysfunction. A lot of times there are other underlying things like cancer, prostatitis, bladder infection. So it's really important that you go to your doctor to find out exactly what is causing your pelvic floor problems. So let's talk about hypertonic pelvic floor and how you can work your abdominals when you suffer from this type of disorder. First off, let's talk about relaxation, because it's really important that we all relax those muscles, because in essence, that's what's causing it, trigger points. That muscle doesn't want to relax. It wants to stay tight because it's pissed off about something. So you want to get them to relax, and breathing is really important because your pelvic floor muscles are antagonistic to your breathing. So if you really focus on relaxing your pelvic floor and using it in unison with your breathing, you can control those muscles and get them to relax on your own. If you can't, you're probably going to need to see a good therapist or a person that specializes in trigger point therapy that can guide you in that direction. And you want to look on the National Association of Trigger Point Therapists website. Just Google it and they can tell you more about that. So let's talk about hypertonic muscles and how you can work your abdominals when you suffer from that. Because let's face it, a lot of us can't do typical abdominal exercises when we suffer from hypertonic pelvic floor muscles. Especially other exercises might aggravate it, like the squat and the deadlift, or any time you need to use a weight belt when you're working out. So if you got a personal trainer or a physical therapist that sticks one of these babies on you and wants you to work out and you suffer from hypertonic pelvic floor muscles, definitely want to run the other way. So let's talk about the first movement. The first movement is the pelvic draw, okay? So what you want to do is you want to lay on your back. And again, really focus on relaxing, okay? Because that's the first and foremost important thing when you work the pelvic floor, or try to get it to relax, all right, is your breathing. So just start off with 5 or 10 good breaths, deep breaths, to get everything to relax down there, okay? So the pelvic draw works the transverse abdominis, all right? The transverse abdominis acts like a natural weight belt. It kind of holds everything in. And women, a lot of times, you guys go out at night, you wear an outfit that you want to look good and you always want to suck your tummy in and hold it there. Well, that can cause problems if you suffer from hypertonic pelvic floor muscles. Because think about it, you're sucking in that stomach and holding it all night, so all those muscles are jacked up and just screaming because they want to relax. So this exercise helps strengthen the transverse abdominis, so it basically helps keep the tummy in, so it's really important. So what you want to do, as I said, just relax, 5 or 10 good deep breaths, and then start out with a big breath in, and then slowly let the air out. And as you let the air out, I want you to think of dropping your stomach to your spine, so your belly button, you're almost trying to touch your spine with it. And then hold it there for 5 seconds. So you do a little demonstration here. You just take a big breath in, slowly exhale. When you get to the end of your exhale, you're going to want to hold your breath and let your stomach drop and hold it. Now I want you to think about focusing on relaxing all the muscles in the pelvic floor as you push your abdominal muscles downward. Hold it for 5 seconds and then breathe in. Now that whole time you're basically holding your breath, but you're doing it in a way where you're relaxed, you exhale, and you just let all the muscles relax, okay? You want to do that about 7 times, basically in and out, 5-second hold for 7 reps. You can do 1 set in the morning, that's 1 set, 7 reps, and then do 1 set at night. Again, you don't want to do everything where you overwork it or overexert it. You just want to do enough to keep it in shape until you get this problem under control. All right, so that's the pelvic draw or vacuum as it's called. The next thing we're going to talk about is a plank. Now, some people might object to doing a plank, but if you're someone that's just doing a mild plank or a slight variation of it, it's really good for the stomach because it works the entire core. Your rectus abdominis, your transverse abdominis, your obliques, your intercostals, it works it all. So it's a really good movement, and you can modify it to make it relatively easy on the pelvic floor muscles. So let's start out. Most of you think of a regular push-up as working your chest or your upper body, but you also got to realize you're working your core when you're doing a push-up, because what you have to do is keep your body stable, and your stomach is the connecting point between your upper body and your lower body. So here's a typical plank for a push-up position. Now remember, you got to keep the head slightly forward, not up like this, because you want to prevent putting excessive strain on your neck. You want to keep the shoulders nice and square, and then you don't want the hips to drop, okay? You want to keep the hips up and tuck the butt down. And then focus on that breathing, nice and easy. And also always think to relax your pelvic floor, okay? In and out, nice and easy. Hold it for about 30 seconds, and then come on down. Now, another variation of this to make it a little easier is to get on your elbows. Now, keep in mind, when you're on your elbows like this, the farther out your elbows are, the harder it's going to be. So you want to make sure those elbows are directly underneath you to make this movement a little bit easier. If you find it's a little hard to do that, just move forward a little bit, all right? Now remember, hips are high, butt's tucked under, breathe nice and easy in and out, all right? Now, the other thing, there's other variations to do a plank, but most of them are a lot harder, so you want to avoid doing those. Another thing we can talk about is a side bridge, okay? A side bridge is going to help work the quadratus lumborum and also the obliques and those muscles, and they also help in the support of the lower back. So another variation of the plank is the side plank. So you lay on your elbow, your legs straight out in front of you, you put your hand on your hip, and then raise up and hold. Again, always thinking about relaxing that pelvic floor, okay? Now some of you, it might help to close your eyes and really visualize this. Just picture those muscles completely relaxing, all right? Now this is a little harder than a regular plank because you're up on one arm. So you only want to hold these for about 15 to 20 seconds. All right, make sure you use a mat so something supports your elbow, it's not digging into the hard floor. Now another variation of this that I like to do is I like to prop my legs up on a pad. Now you can use an aerobics mat or you can use a foam roller. I prefer a foam roller, it's a little higher. Get up on the elbow, hand on the hip, and then you'd raise up and down. Now a good number of these to do would probably be 10. You want to make sure you do both sides, okay? Don't just do one side, flip to the other side. Just turn over, bring your pad over if you're doing the up and downs I just did, and raise up. Raise up. Now your breathing sequence is breathe out as you go up. Out as you go up. Now I'm going a little fast here, but really the cadence you want to follow is up, 1, 2, down. Up, 1, 2, down. Up, 1, 2, down. Again, do about 10 of them, okay? Well, that's about it for today. I hope that helped you out, and we'll see you next time. Take care.